Clinical trials are essential to advancing healthcare, but historically women, especially women of color, have been underrepresented in cardiovascular research. Today we're speaking with Dr. Roxana Miran from Mount Sinai Health Systems, who will tell us more about the clinical trial process and how you can participate in local clinical trials, including Librexia, a comprehensive clinical program covering a number of cardiovascular diseases. So thank you for joining us, Dr. Miran. What are the clinical trials and why are they important specifically for women of color?
Well, first of all, I think it's really important that you're covering this topic, and thank you for this. Heart disease is the #1 killer of men and women across the globe, and I think it's very important to understand how we could find treatments to reduce the burden of cardiovascular disease. And the Librexia program is doing exactly that in 3 different areas: atrial fibrillation, stroke, and heart attacks. Atrial fibrillation is that irregular heart rhythm. About 60 million people are affected by it. And about a quarter of our strokes that we see, which is about 700,000 strokes a year in the United States alone, about a quarter are from atrial fibrillation. So a very important cause of stroke or causal relationship. These trials examine the new drugs, devices, and this particular one is obviously a new therapeutic modality to reduce the burden and the complications from heart attacks, stroke, and atrial fibrillation. Over 50,000 patients will be enrolled. And what's really important is that the clinical trials and who's in them, where we're examining the efficacy and the safety of that drug, is representative of the population of patients we're treating, which are Blacks and whites, people of color, and women. And often women and people of color are underrepresented in trials. So we hardly know, are these drugs really effective? And so in this trial, we're doing everything to be sure that the drug is for everyone and that everyone is included. So if you really want to know more, you should go on the website researchincludesme.com and find more information. And the Librexia program will be very, very happy if you fit into the trial to be included and, of course, participate.
All right, doctor, can you talk about the importance of diversity in clinical trials?
And so imagine often what we're seeing is an underrepresentation in the clinical trials of these new drugs and devices of women and people of color. And so if you think about that, and then the drug and device becomes available, it's for everyone. So the trials need to be exactly as diverse as the patient population that we're treating. So very, very important to have a diverse patient population in our clinical trials, just like anything else. It's good for all of us to just be diverse.
You explained that very well. So can you also explain the clinical trial process? Now, what can participants expect when they enroll in a clinical trial?
Yeah, it's an interesting process, right? So the drug is not yet approved, and it's under examination of how it will work, and that's what a clinical trial will do. It's designed to be sure that the right patient gets in with those conditions, the drug is given. And then, of course, what you want to know is it helping them? Is it reducing those complications with regard to the heart attacks, stroke, or even dying? And then what we are also measuring is the safety of the drug. So isn't it important to make sure we're diverse? And it's not just white patients in the clinical trial or white men. We need everyone, all patients, everyone to participate. So it's really important to be part of the clinical trial process because that's how we get better and we improve human health.
Yeah, if you're going to treat everyone, you should probably study everyone, right? So if someone's interested in joining a clinical trial, how do they enroll?
Well, if you go to researchincludesme.com, you will find a hospital near you that is participating in this program. Librexia program will enroll over 50,000 patients. So there's going to be a hospital near you, lots and lots of sites all around the United States participating in this in this program, and hopefully you will be one of them if you fit into the trial.
Doctor, thank you very much for your time this morning. Before I let you go, where can we send viewers for more information?
ResearchIncludesMe.com.
Perfect. Thank you so very much, Doctor. We really appreciate you spending some time with us this morning. And guys, if you want to catch this segment again, head over to FCN Plus.